Hi viewers, good afternoon. Another episode of Guest with Nazir. We are honored today. We are discussing a professional's life who's a doctor, writer and singer, Dr. Asad Kazmi. Welcome, Doctor, in our show.
Thank you very much. Thanks.
Asad, please tell our viewers about your early days and your qualifications.
I am basically from the quite a humble background from a village from Pakistan. From district Rawalpindi. I received my MBBS degree from Ayub Medical College, Abbottabad, which is one of the northern areas district in Pakistan. And after that, I completed my house job, which is called Foundation here in UK, in different hospitals of Pakistan, in 2011. And then I came to UK in around 2012. And then basically, like all overseas doctors, I had to go through PLAB exam and English language competency exams, which I did, and then finally I received my medical license to practice from General Medical Council UK in the beginning of 2014, and then I started my service in NHS, and since then I have been working in different specialities of general medicine all over the NHS.
Asad, such a long life, you have made it very easy just in few phrases and few words. Please tell us about your, when we talk about your primary education, especially for viewers' interest, what is your village called?
It's a Sagri. It's spelled like Sagri. Sagri. It's a small town on the periphery of district Rawalpindi, which has quite a historical background. At one time, before the independence, it was quite a big market for all the Kashmir and Potwar region. And after the independence time, basically with the development of GT Road and other main highways, it went on a side, and then it just transformed into a small
village
town and village. Yeah.
So, Dr. Asad, you have practiced in both countries, in Great Britain and Pakistan.
Yeah.
So, how you see the practice difference in Great Britain and Pakistan, and how you find the experience?
Basically, the fundamental principles of practicing medicine are the same. We have back home we have the same syllabus which is taught in UK to all medical students, and education structure is quite similar, basically because it's a carbon copy of UK education system. So our medical education is quite similar to UK. Obviously, with the lack of resources, we have just limited access to the exposure which UK graduates have. The basic difference which I realized after working in both systems was that in our system back home, because of the limitation of resources, we have to rely more on clinical skills, and we have to be very careful while requesting investigations, because we always have to consider cost effectiveness of all the investigation. Here in UK, because resources are much better as compared to Pakistan, so we can rely more on investigations along with our clinical skills. And secondly, the main difference which I have felt here is that here the training system is more structured. Trainees get more exposure as compared to our Pakistani medical practice. So a medical student in UK, when he's not graduated yet, he clear cut. He's very clear in his mind, and he knows clear cut that what specialty he's going to adopt for rest of his life. While back home, because of the lack of exposure and lack of the career counseling, even after the graduation, majority of our doctors are not still very clear in their mind that what they need to do for the rest of the life. So it's basically a bit of lack of structure and lack of career counseling back home.
So when we talk about the time frame and discuss it, so is the same time frame if, let's say, a student or fresh student start his career after O level, how long it takes in Pakistan and how long it takes here? So I'm talking about the practical aspect of it and also the educational aspect of it.
Basically, the training time scale is almost very similar. After graduating from medical school in Pakistan, it takes about 6 to 7 years to earn a specialization degree, and very much similar is the case in UK as well for most of the specialities. There are just few specialities which have lesser training time because of their small scope, but otherwise time scale is almost the same.
There is always room for the improvement.
Yes.
If I will say what 2 changes you will introduce here in the system and what 2 or 3 changes you will introduce, especially I'm talking about the training system for the medicine students and graduates in Pakistan. So how we will take that, if we'll give them 2 or 3 new things which they need to implement there, and if we want to take few things from here, so how we will like exchange of ideas. So what 2 ideas you will take and what 2 ideas will give to them?
Considering Pakistan's situation, for me, the best thing which I would like to do is developing a better primary care healthcare system. Our healthcare system basically is a copy of a British health system, which was set up there before independence in 1947. But it has not been developed over the years since independence. So basically, I would like to introduce training for general practice in Pakistan as it is in UK. Here in UK, GPs have to go through a training program for 3 to 4 years after their medical graduation so that they can be certified to practice as a general practitioner. While in Pakistan, there is no such structure. Any medical student who earns his medical graduation, he can just do general practice straight away after coming out of medical school. So there is no training structure to be a GP or a general practitioner in Pakistan. That's I think the basic thing. If you have a good primary care structure, then it reduces massively the load from secondary care structure and from your hospitals, and that is the biggest difference to me in the health systems of UK and Pakistan. So I think that main focus should be on primary care system in Pakistan. Now coming to UK, I think that with the ongoing pressures on NHS, trainees do not get much time for their studies and for their curricular activities, and they are under more pressure on delivering their services in hospitals instead of focusing on their training and getting more and more experience.
Do you think in Pakistan there need to be a tougher laws for the quackery? Because a lot of quacks, when they do experiments, and a lot of people, even some cases, lose their lives, so they need to be tough laws.
Yes, massive need for a very strong and strict legislation is needed in Pakistan, because not even I have been surprised many times that not even even a trained nurse or a dispenser, but actually the quakes who don't know anything about medicine or practicing medicine safely, they are practicing in Pakistan, which is a major concern. And you can even locate people practicing dentistry on the side roads, sitting on the roadside,
And they have beautiful some artistry designs around them. So
yes, and people are doing oral surgeries just on the roadside, sitting on a chair and a table, which is very alarming for me.
But also at the same time, this is also affordability issue, because people can't afford to pay in the private sector, because if somebody wants to go to a qualified doctor, they have to pay for the consultancy fee, then on the top they have to pay the test fee, and then at the end they have to pay for the medication. So do you think that the government should also contribute more towards, especially we're talking about Pakistan?
Yes, definitely. The problem at the moment with the current governance in Pakistan is that the focus is education and health is not the priority for governments at the moment. They rely more on development goals and building bridges and roads because it earns them good
Structure change is also important, but at the same time, medicine, education, and clean drinking water.
Yes, that's the major issue, because at the moment, you pointed very rightly that clean drinking water is one of the most serious issues at the moment, because if you look at the statistics about hepatitis B and C, it's
alarming.
It's alarming. It's alarming as a society. We need to seriously think about that where we are going as a society, because we need to make education and health our priority. If you look at the health budget at the moment, especially in the biggest province of Pakistan, Punjab, you will be amazed that how much less amount we are spending as compared to other developed countries.
Being a professional, what you suggest, doctors or any professionals, what we can do to eliminate poverty and especially the pains in the world which are existing, whether it's Pakistan, whether it's Africa, anywhere in the world. So what are your suggestions about that?
I think that basically, if we work collectively as a society, we can just work around the financial issues. Like if you talk about the underdeveloped countries like Pakistan, for instance, if we introduce a proper taxation as the taxation system is in UK, if the tax net is implemented properly, we can generate sufficient money to invest on health system. And even with the current financial situation, if we can just make health and education as a priority, we can treat a health system as a priority, we can make a big difference for our poor section of the community. But it is quite unfortunate that at the moment, basically, governments in underdeveloped countries, they don't consider health as their priority. That's the main.
And what's your viewpoint? Sorry for interruption. Because of the time restraints, sometimes we have to quick. What are your viewpoint that from doctors from South Asia, they are contributing at the moment in NHS, a huge number of doctors. So what is your viewpoint on that? So
I think it's a very encouraging aspect for me. When I started my practice in UK, I was not familiar with the NHS system initially, but when I started working here, I was amazed that how many subcontinent doctors are working here, and they are respected so much here by the community. They are rated so high by British and English people, and they are trusted to such an extent that I feel honored to be a subcontinent doctor
So
serving
most of the
UK.
time you are practicing in Sheffield.
Yes.
As a city, how you feel now as a Sheffielder?
I just feel proud to be in Sheffield. I have worked in different parts of UK. I worked in London, I worked in Peterborough, I worked in Birmingham, Worcester, Derby, and I served all the NHS trusts in these areas. But I just keep saying wherever I go that I have worked everywhere, but I cannot stay away from Sheffield. I love to stay in Sheffield and I love to work in Sheffield.
I know your family is here, but
Yes.
that is the only reason, or you like the people of Sheffield? So what is the other reason?
That's what I have expressed on a number of times while talking to people in different regions of the UK, that the main reason to stay in Sheffield and to like Sheffield so much is that the people of Sheffield are so soft-spoken, they are so welcoming, and they are so warm emotionally that if you once spend some time in Sheffield, it is very difficult to leave Sheffield then.
Dr. Asad, what are your tips for the doctors who are coming, and especially the youngsters who are watching our show, who wants to become doctors in coming life? So what are your tips for them? What kind of books they should read, what kind of studies they should observe, and what kind of focus they should have to become a good doctor?
The most important piece of advice which I think should be given to the medical students is to study other subjects apart from medicine as well. They should study literature as well. I study literature myself now. They should study history, and they should study the language and different cultures as well, because then as a practicing doctor it gives you a more holistic view of any patients or any culture.
So it means you should be an anthropologist, and at the same time you should be a doctor.
Yes. Basically, when I started working in acute medicine in UK, initially my approach was just when someone presents to me with some complaint, I was just focusing on complaint, making a diagnosis, doing investigations, treating, and then discharging patient back to home when they are feeling well. But now I have realized that practicing medicine is much more than that. You have to just consider a holistic, a full picture of a patient, not just his illness, certain part of his illness, and for that you have to be very open-minded as a doctor, and you have to be aware of other subjects of life as well, not just the medicine.
Dr. Asad, what is your focus on in your writing? I know you're writing some articles on different subjects. So what is the main focus of your writings?
At the moment, I'm focusing on the political issues back home. I am very much interested in Pakistani politics. As a medical student, I was never interested in politics or political debates. But since I came to UK and I observed the political system of this country, I have realized that unless educated people don't contribute to politics, whether it's in the form of their practical struggle, or it's in the form of their debates or their writings, society cannot improve and society cannot progress in democratic values. And that's why I have started writing in newspapers about the political issues in Pakistan, and I think that more and more educated people should come forward and start expressing, and we should not leave politics just for the for the uneducated.
It means
people.
education can change the politics.
Yes.
Thank you very much, Dr. Asad.
You're welcome.
Viewers, this was the episode of Guest with Nazir. Keep watching Sheffield Live. Thank you.